Welcome to ADAPT NCLEX, and thank you for deciding to watch this video. Do you know one of the questions the board favorites? The board favorite, they like asking every time on a question, either prioritization, select or apply. It's right in front of you, sulfur drug. Do you want to know who they are? Which medications are considered sulfur drug? There's a lot of them. But those that they test most. So let's take a ride. So this is the case form so that you can be familiar and more comfortable with case presentation. Client present to the clinic, very important, the setting, this is the way. So I'm giving you a way you can read case studies, memorizing and mastering it. Setting is very important. You can't do anything that much. You have to send the patient to the emergency room if you have to intervene. Most of the time, education and teaching. Age is important. 35-year-old may present to the PCP clinic with complaint of what? Small red purplish rash on the chest for 2 days. This is always what they will present. And for case study, the first 2 lines are very important. It will lead you to the diagnosis. That 2 lines are packed with buzzwords, I call them. So this is number 1. Small red purplish rash on the chest is very dangerous. You also report of sunburn, number 2, yesterday after the football game. That means he's being on the sun. He has runny nose and a report of UR symptoms. This is also dangerous. It's not sulfur drug related. The patient is suffering from side effect from sulfur drug. So we got to watch this. So he's been having this for 3 days. He feels weak, fatigue, and chills this morning. Non-specific, this look like flu-like symptoms, right? This morning, you notice severe left flank pain that radiates to the groin. What usually is severe flank when you go into your groin? This is following the kidney pathway. So this may be kidney stone. Your kidney is on your back. When you have problem with your kidney, especially stone, you start from flank and go into your groin. If the pain goes to the umbilicus, this is a pyelonephritis. If you go into the groin, it's mostly kidney stone. If you have pain that stay over here, it's cystitis in the bladder area. That's the difference you can distinguish. Is on this medication, metronidazole for UTI, allopurinol for gout, phenotime for seizure, carbamazepine for trigeminal neuralgia, trimethoprim, sulfamethoxazole for skin infection. Is on sulfasalazine for ulcerative colitis, riveride for type 2 diabetes, and silvadine that is using for second-degree burn to the left forearm. You see, one person has a bunch of medication and medical problem. I intentionally said it, and you know what I'm trying to do. It's on all these medication for these medical problems. This is to give you an idea of what these medications are, that they can be common, a lot of people can be on. When you do a lab work, it's neutrophil is less than 100. What are your buzzwords and priority findings? Buzzwords, priority finding to make the diagnosis. So let's think. We have a patient, 35-year-old, who had a small purple rash, a sunburn, right? A runny nose, and a severe left flank pain radiating to the ground. And he's on a bunch of this medication. So let's see. We have a rash. This is Stevens-Johnson syndrome. And we have a sunburn. This is photosensitivity. Then we have a runny nose. So URI symptoms, flu-like symptoms. This is being worsened or caused by something. Okay, that patient probably related, unrelated. But this is worrisome because his neutrophil is less than 100. This is agranulocytosis. If your neutrophil is less than 1,000, so neutrophil, if they are less than 1,000, this is what we call neutropenia. If you go below 100, it's agranulocytosis. And then he has a severe flank pain that will radiate to the groin. So this is flank pain to groin. This is stone. It's formed by crystallization of the sulfur drug. Basically, I'm giving it away. So what are the side effects of sulfur drug? Stevens-Johnson syndrome, sunburn, photosensitivity, agranulocytosis, okay, and crystallization. Therefore, all this is worrisome. What are your B-sharp moments? Those that you really, really have to worry about is carbamazepine, is Stevens-Johnson syndrome, and agranulocytosis. Photosensitivity, not that bad. Stone formation, not that bad. But these two, you cannot prevent it. You cannot prevent Stevens-Johnson syndrome and granulocytosis. You can prevent and help eliminate the progression of taking sulfur drug and developing stone or photosensitivity. So what are all this? These are all sulfur drugs. Metronidazole, common, we take it all the time for UTI, other medical problem, also infection is a sulfur drug. Allopurinol for gout, we can use it for other problem, it's also a sulfur drug. Phenotime for seizure disorder, sulfur drug. Carbamazepine is also used for seizure and then trigeminal neuralgia. Bactrim, okay, is also used for skin infection and UTI. We can also use for UTI all the time. We prescribe it all the time. Sulfasalazine for ulcerative colitis, gribulide, or sulfururea. So gribulide is a sulfururea. So all sulfururea are sulfur drug. And Silverdin, you can see there's S there. So these ones give it away. Those with the S, they start with sulfur, silver, something. They give you a clue. There's others that does not have the idea. So what did this patient have? Complications of sulfur drug. He has a rash, Stevens-Johnson syndrome. He has a sunburn, photosensitivity. He feels weak, fatigue, and chills because he's getting sick. He has neutropenia. And because he has urine symptoms for 2 days. Agranulocytosis with mild UR symptoms, you should intervene. This patient is developing sepsis and he has formed kidney stone. So it has all the features. These are your buzzwords. When you see them, something should be ringing. So anybody taking these medications and has rash on the chest, a priority intervention. You got to see this patient. Anybody taking this medication and sunburn, not really. You can educate them. If they have neutropenia, they tell you their white count is low, you have to see them. They develop a granulocytosis or they're getting sick from this, yeah, it become a problem. Crystallization from a kidney stone, so it's not that big a problem. So that's what we have. So what is the question? Which of the following medication is responsible for the current condition of the patient? I already given you the answers. Metronidazole is select or apply. It's a plasma scoring. If you don't know the answer, don't pick it. Metronidazole, 1. Allopurinol, 2. Phenotime, carbamazepine, trimethoprim, sulfamethoxazole, sulfasalazine, riveride, and sulfidine. Like I said, all sulfuria and sulfur drug. These guys give it away. This one to give it away. Sulfur. There's nothing to tell you that. Phenotime, nothing. Allopurinol. So, agranulocytosis, photosensitivity, crystallization, forming stone, and finally, Steven-Johnson syndrome. Every patient taking sulfur drug, you should worry about. Which ones have I left out? I intentionally do that, right? Who do you think? Diuretics. They also sulfur drugs. So hydrochlorothiazide, sulfur drug, chlorothiridone, which is a group of it's a form of hydrochlorothiazide. It's also sulfur drug. So a sulfur drug. Then furosemide. It's also a sulfur drug, right? Any loop diuretic. Any loop diuretic is also a sulfur drug. So furosemide humiditimide, all the mides, which are loop diuretics, are sulfur drug. So don't forget about them. We don't talk about them that much because we focus on the diuretic effect and then their side effect, even spironolactone, which is also a diuretic. So they are all sulfur drugs. So sulfur, hydrochlorothiazide, chlorothiridone, furosemide, bumetimide, even you can have spironolactone in it. These are all diuretics that are also a sulfur drug, and therefore they can cause all this problem. As you can see, the list is not exhausted, but I know you're familiar with this medication. That's why I lost them. And I kept this diuretic away and later on bringing in order to show you how important this medication and its side effect, agranulocytosis, photosensitivity, crystallization, and Steven-Johnson syndrome. Why this problem is, this patient is in trouble. He has a neutrophil less than 10, agranulocytosis, and he is running nose, and he has UR symptoms. He's having fever and chills, so he's developing sepsis. We got to send this patient to the emergency room right now. So what is your education? How do you prevent this? Okay, how do you prevent this at all? To prevent crystallization, so this is crystallization. What you do is tell them to drink 2 to 3 liters of water a day. So this will help, like 8 ounces of water to help with that. They take the medication. Okay. The issue for for the sunburn, which is photosensitivity, wear a hat when you're going outside, long sleeves, okay, and then put a sunscreen on, okay. Put the sunscreen on with a factor greater than 15%. That means some sunscreen doesn't have a sunscreen protection factor. So you want something with a sunscreen protection factor greater than 15%. Okay. Very, very important. Any signs of UR symptoms, any diarrhea, okay, any nausea, vomit, well, call me, because you may develop a granulocytosis. So any signs of infection, yeah, you need to call as soon as possible. They also, because sulfur usually lower your folic acid, you need to take folic acid. At least 1 milligram a day to help replace that. Okay, and those are, and you watch to teach them about the Stevens-Johnson syndrome. If they see small rash in their chest, yeah, call me as soon as possible before it develops into sepsis. So this is the key fact about sulfur drug, the side effects they're teaching. You see, this is a select or apply. This may be prioritization. So there's so many questions they can ask you. I want you to memorize it, ingrate it in your brain, and know all the signs and symptoms of sulfur drug and which medications are part of it so that you can teach the patient about it. Okay, take care of yourself and all the best of luck. If you've not subscribed, subscribe to this channel for more content like that. Thank you for watching. Bye-bye.